They have an advertisement featuring a woman who got this test done. She was having stomach problems and found out that she had a very specific disorder. We're going to play this clip here from this woman.
When I was in my 20s, I started noticing that I was having problems with anemia. A couple years after that, I noticed that I was having just stomach problems. I've suffered for 15 years with stomach problems that I just thought was just going to be my normal. When I got my results back, the biggest red flag was for celiac disease, something that I'd never even heard of. And thankfully, the 23andMe website had a link, so I clicked on celiac disease and it described it. And I said, oh my gosh, is that what I've had this whole time and didn't even know it?
So there is a kind of success story, right, from this company 23andMe, and this ad, which we showed about 20 seconds of, it's about 3 minutes, and it does feature a doctor, and she says after she got this test, she consults with her doctor, and then the doctor does a blood test based on this information that she's gotten from 23andMe. What's your response to that?
Well, so as I said, for a few people, a small, tiny percent of people who undergo testing through 23andMe, they may get information that may be useful,
right,
but the majority do not. So for her case, for instance, based on the ad, celiac disease, a gene she has are genes that 40%, 35 or 40% of Americans have.
Okay.
And of those who have the gene, only 1 to 4% actually have the disease, will ever get the disease. So if you take 1,000 people who undergo testing for 23andMe, 350 to 400 people are going to be told, guess what? You have this gene, means you might have celiac disease.
Okay.
Those who get tested, really only 8 or 10 people are going to end up having it. So you have 390 people are going to be told you have this increased risk of celiac disease, and it's meaningless. It doesn't mean they have increased rates of celiac disease. They are perfectly fine. They'll never get the disease.
Right.
So you have a lot of people who may get very anxious and depressed, and I would argue a good clinician should listen to a patient's story and hear, oh my God, maybe it's celiac disease. Rather than relying on a test that in 95% of people is not going to indicate disease even when it's positive.